Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work. Hi, everyone. Welcome to the Transforming Healthcare Coaching Podcast. We want healthcare to be different, and as coaches, we want all healthcare clinicians and leaders to thrive. Our goal is to provide you with valuable insights, expert interviews, and practical advice to empower you on your path to becoming a better version of you at work and life. I'm your host, Lillian Liang Emlet, the founder of Transforming Healthcare Coaching, and I'm joined each week by our incredible coaches. And also, this week, I'm super excited to have a guest interview on today. And so I'd like to introduce you to Dr. Camille White, who is an executive coach, motivational speaker at Inspire to Evolve, and I will let her introduce herself before we get started with our talk today.
Hello, so happy to be here. My name is Dr. Camille White. I'm the CEO of Inspire to Evolve Executive Coaching Services. I inspire, motivate, and challenge people to navigate their careers, have less stress, more success, and better health outcomes. So happy to be here, and especially contribute to this conversation around healthcare and the physician space. My story is a little interesting. I started off in healthcare. I'm a physician by training. And then I pivoted my career to government, working in tech, and then later on to big tech. So started off in healthcare, and that's all I knew, basically. I got a MD as well as an MHA. I did the dual degree path and decided to make a pivot. I realized that with the technology, I could impact more than that one person that I was seeing at a time. And did the two pivots, the government and big tech. The last company that I worked for was Salesforce. My career spanning achievement with the technology is that I was able to impact 9 million people by creating access to care. So that's what I'm most proud of.
That's so amazing. And so, just for everyone, just to remind everyone, today's talk actually is about mental and emotional resilience in the face of trauma. And I'm really blessed to actually have Dr. Camille here with us because her journey is so unique. And I just want to commend you on the fact that all these pivots, right? All of these pivots from going, I can just imagine you sitting next to me in med school and imagining a clinical life and then making that first big pivot. I'm curious, how did that first inflection point become evident to you to do something different with a traditional clinical career?
I loved medicine, and you learn so much and the light bulb goes off. You're like, this is how they do it. And I love seeing patients. But then when I got my master's in health administration, learning about the system, learning about the Centers for Medicare and Medicaid Services, learning about the payments, learning about how hospitals actually work, the light bulb went off. This is a business. And it actually is. And so sitting through those classes, and then I came to an inflection point in medicine that I just didn't like the way I was being treated. I experienced some burnout, the hierarchy, the racism that I didn't want to acknowledge at the time. I just thought it was maybe I'm not good enough. Maybe I should be working harder. And then from that business aspect, again, seeing that physicians really weren't in control. It was more, to me, it seemed more of the insurance companies. At that time, there were gag orders in place. Hospital executives could come down on you about not meeting your goals or what have you. And so the idealism of medicine and creating those relationships with patients and being able to counsel them on what was the best path forward. Once I got in there, I saw a different story. At the time, there was a push for physicians to become autonomous agents, right? That's when the hospitalist, that conversation started to be happening. But there was that also push for physicians to be more in leadership positions so that we could guide the way. And it just so happens we're doing an implementation for electronic medical records and some other things. And the chairman of internal medicine, he had the largest budget. And he approached me about it, and I began working with the physicians. And then the government came to the hospital, and I was recruited by them. So that was the big inflection point.
That's a big one. That's just a total leap, right? To go from what you think is going to be at the bedside to really having your eyes opened by the MHA. I'm actually, maybe I'll just go ahead and ask this question because I actually get this quite commonly from my own trainees, even now. MHA, MBA,
Oh, yeah.
MPH? Like, what is the difference between all of these different degrees? And when you looked into them, what advantages or differences are there really? Or is any of them fine as long as you can open your networks for different people doing different leadership positions?
So I thought that my universe was hospitals and healthcare systems and taking care of people. And so the MHA, the Masters in Health Administration, made the most sense for me, especially coming from that physician background. I thought that I could be president of a hospital or something like that. And so the MBA is business, and healthcare is a different industry, all of its own, a different system. So the MBA really didn't align with what I wanted to do. But I can say that as an entrepreneur with my MHA, the first time I wanted to set up a business, I was like, I have a master's in health administration, which is supposed to be a master's in some sort of business, and I don't know how to set up a business for myself. So I had to go back and do additional research to get that business side of it versus healthcare.
That's so interesting. It just goes to show that healthcare is its own industry, its own
Oh,
beast.
its own. And that is an interesting tidbit because when I went into digital health, initially I was working for the government. I started my own business and I was doing government contracts and then went to Oracle and Salesforce and some heavy hitters, Google, and I worked across pharma, big pharma companies, med tech companies, payers and providers. But the people who built the technology really do not understand how healthcare works. And so that created a sweet spot for me. We had these developers that created technology, but they did not know how physicians thought about things. They didn't know what a clinical workflow was, and they really didn't know what keeps the doors of the hospital open.
Interesting.
So, so
That's
like
interesting.
if I mention physician's fee schedule to them, what? So that was my value. I was able to sit in that sweet spot between the physicians and the developers. And so I remember a time working for a very large tech company where they sent this group of people in to talk to doctors. And they had done maybe an implementation in retail, maybe Macy's or something. They sent this Macy's gang to a hospital. I said, oh my gosh, they're getting eaten alive. They sent them. And the group was like, nah.
Right.
And I remember going to a large hospital and where we had an innovation center where you would talk them through the technology and everything. And I came in the door and they're just looking, hi, I'm going around the room saying hello to everyone. They're ignoring me or whatever. And so it was time for me to introduce myself. So I go to the front of the room and I tell them my name and I say my largest implementation was for, I've been over an implementation for 9 million people, 720 clinical facilities. And you just heard like a mic drop, like, who is this lady? And so being able to give that credibility, I understand what your trials and tribulations are. I understand what the hiccups are actually on the floor. And if you tell me what you need, I can convey that to the developers. So that was really, that was, that's fantastic.
Yeah. It is interesting. I'm sure you've watched the wars between some of the largest electronic health records, and now with the generative AI and all the micro companies now trying to insert themselves as interoperable platforms so that we can all be able to hopefully have a much more intuitive, voice activated
Sure.
way of experiencing life. And it's hopefully going to be really a great boom for being both on the patient side and also on the clinician side to be able to do all the things. But I do agree with you. It's going to be about the translation of how whatever the data pieces that are necessary to get to both ordering and follow-up and communication and then closing the loop with billing and things like that are
Oh,
really just gonna be
that's
very
a
interesting translations.
that is a big deal. I do not want to go through all these screens just to get work when my job is to take care of people. And now I'm dealing with all of this over here and it's adding to my workload. In some instances, folks are constrained to 15 minutes for a follow-up appointment, 45 minutes for a new patient. And you're doing all of this. It's just not helpful.
Right. And I know that some of our listeners will actually be very skeptical right now because they really sometimes shake their head in frustration at the electronic health record. And so I guess I'm curious, being on the other side and watching technology help huge amounts of people, systems, care delivery, and now to the point where right now when we have a downtime, now people lose their minds the other way. I'm curious the lessons you've learned in that unique space of being able to translate. What lessons would you impart to younger physicians now as they now see the new opportunity with AI, right? You were back when EHRs became like the thing of what it is now. We can't live without them now.
Oh
We're
my
we're on a new
gosh.
frontier. I'm curious if you had any advice for someone who's in your shoes, 20 years younger, who now I have the opportunity to dream big, whether it be a physician or a nurse. I'm curious what you might say.
Listen, people were laughing at me when I said,
Mhm.
no, I think I want to do X, Y, and Z. And I would say, always think about expansion, right? So with Inspire to Evolve Executive Coaching Services, I really lean into the growth mindset. I really lean into joy, abundance, and expansion. And we're trained to be physicians. And that's all we know.
Right.
That's all we know. And you have to have those blinders on in order to be successful. But you should start thinking about what else you can do. With the growth mindset, it is, yes, I'm here and I've solved this problem, but what will be the next frontier for me? And we're all very talented and we've had extracurricular activities, things that we loved before we went into medicine. Don't cut that part of your life off. Take it with you and continue to evolve in that way. So that's the biggest thing. And then I would say, forget about the naysayers.
Mhm.
Physicians can be very skeptical, right?
Yes.
So always be learning something new and figuring out what's going on, but don't get taken advantage of either. When I first wanted to go into digital health, not necessarily the electronic medical records, but digital health,
Okay.
I went to a conference and there were some folks from Deloitte there. And there was a guy, I can't remember his name, he was a physician. He was doing double and triple duty. He still had clinical work that he was doing. He was like writing papers and he was consulting for Deloitte as far as getting people to lean into the digital health. And I went to talk to him like, how did you get in this space? And he said he just used what he already had, his understanding. And that's what I did. But he warned me, he said, these are 3 different jobs that I'm doing. So decide what it is that you want to do and have a closer look at your schedule. But we take it for granted. Developers are creating this technology. That's what they don't know. And it's more than, oh, doctors are exhausted by too many clicks. They're maybe not even understanding that hospitals will have certain contracts in place for pharmaceutical medications. They're not understanding that in the surgical suite, if you have new technology, there might be a mode of education that needs to be involved. They're not understanding, hey, what's CMS going to pay for? They are not understanding that and they expect to push technology in front of you and you automatically embrace it. It's just not that way.
I love those are really some really great pearls in terms of really just to not worrying about the naysayers, continue to bring your whole self, your whole curiosity, and all that growth mindset, learning mindset that really served you well all the way up through medical school. And then for some
Yeah.
reason, I think conformity becomes a thing that we begin to believe. So I guess I'd like to pivot into like my next questions, which is more about so then you ended up leaving. I was really curious about the going to Salesforce and how did you leave the traditional healthcare industry sector and then go into a much bigger Salesforce serves multiple different industries and it's a very large corporation, international corporation. How did you craft that path for that next inflection point?
So going back to all those naysayers, right? When I was in traditional medicine, I experienced a lot of burnout, the critiques, and you're not good enough, and you're wow, and you don't fit in here. You don't look like any of us, that kind of thing. And it just started to weigh me down after a while. And I had become really sick. I was diagnosed with fibromyalgia and chronic fatigue. And so I had to go back to the basics and really lean into meditation and prayer, any type of mindset work, better nutrition. And that takes me to my hour of power, right? I believe in 20 minutes of meditation or affirmations, 20 minutes of exercise, moving your body, and 20 minutes of reading, uplifting information just to begin your day, just to level set what your intentions are going to be. So, first, I had to do that type of work. And then I sat down and said, what can I do next? And I thought about maybe I'll be a teacher, maybe I'll be this, maybe I'll be that. But like I said, the Veterans Health Administration, the government was looking for doctors who wanted to be autonomous agents. And I remembered that. And I set up a business, a small business, did some research on Forbes.com on how to set up a business. And then I started looking at government contracting and I started pitching what I knew and what I could offer. And during that point in my life, I was able to land a $16 billion contract with Cerner and the government. And then I worked with the All of Us research program in genomic research for setting up a 1 million person genomic database. But I started writing down what I knew about healthcare and the processes and how to impact the technology. And when I went to Salesforce, they had a technology called Health Cloud. And to tell you the truth, I didn't know that Salesforce was in healthcare. And I learned about Health Cloud. I knew Google was there, so I learned about Cloud a little bit, but it was more in the conversations that I could have with the physicians. And that's how it happened. A lot of prayer and believing in myself. Then I didn't understand about sales, right? In digital health. And I had to go back to zero and say, as doctors, we're really salespeople. We're seeing, you think about the volumes, right? We're seeing a certain number of patients, and that translates to the health insurance companies, unfortunately. So, yeah, there's sales and everything.
That's really interesting. I wonder whether really most physicians don't think themselves as salespeople at all.
No,
And really good salespeople probably do think themselves more as physicians, right? Salespeople really just want to serve. I think sales in general really comes from a service business mindset. It doesn't come from a performance mindset. But sales is
no.
really about, like you said, the relationships and trying to understand, is there a way we can make this work? Would this be a
That's
good win for both of us?
That's it. Do you trust me? And here's the pathway. This is what I'm suggesting. What do you think about it? It is really a true collaboration. When I had good relationships with patients, it was about that collaboration. They were buying into, yes, that works for me. I can take this medication. I can keep that schedule. Yeah, I'm going to try and exercise a little bit more, that kind of thing. So it translates to technology and working with sales teams.
And it goes to show even more so that diversity really is important. We often hear in the business world that it's okay if there's 7 other executive coaches or 10 other, 20 other coaches into the healthcare sector, right? Because it's okay because everyone's going to resonate differently and have that unique trust bond with every single person. And so with every clinician, and having those different perspectives are really important to have everyone put your shingle up and put your perspective out there, which is obviously why we're chatting today, so that there are more opportunities for people to hear and see maybe themselves in either us or in your journey.
Absolutely. And we both talked about energy at one point, right?
Yeah.
It depends on the energy that you're putting out. The energy that you're putting out is what you're going to get back. And I love how the law of attraction
Mhm.
plays into that. Coming out of traditional medicine, I could have been like, oh, I can never do it. I'm a failure, whatever. But then you have to look at everything you've been able to accomplish coming out of there. I loved it. What was my skill set? Yes, I got burnout. Yes, I was diagnosed with these illnesses, but how do I find a miracle in the mess?
Right.
And how am I able to translate it into something else? And then realize people are watching you,
Mhm.
and your success could be a defining moment for someone else.
I guess I probably should get to some portion of the related to the title of this particular talk. Is a life well lived is often has really great highs and really great lows. And I know you've been willing to share with me a little bit about the trauma and some of the hard things that have happened to you and your family and how they've made you stronger and wiser. And I've always been curious. I think we are all products of our own unique generational trauma and personal traumas. And that is why each person is their own unique, beautiful unicorn. I'm wondering, would you be willing to share with our audience your perspective on some of those events and what's helped you heal and become stronger because of it?
So earlier in the conversation, I talked about my pivot from medicine to technology and how I was feeling coming out of medicine, which I had devoted my life to. And I started that practice, the hour of power. And it really helped to buoy me back up, really helped to build my confidence, my belief in myself and source, right? The universe provides for us. And I had to get back to believing that. Recently, I went through familial homicide. My nephew had a psychotic break and unalived my sister, my oldest nephew. And it came out of the blue. He had been previously stable. My sister had been in the education field for 39 years. And so when this happened, it just really shook me to my core. And I was able to manage by going back to basics, the prayer, the meditation, moving my body just to get out of bed every day. And it took about 2 weeks for me to start actually getting some sort of semblance of normalcy. But it really helped me stay sane. And I offer that because we all go through ups and downs in life. And there has to be something that we can lean on for resilience to get us back into a space of saying, okay, I can do this. I can move forward. With that said, I'm now even more so committed because we can say, oh, I'm so busy. I don't have time to pray or meditate or think about how I want my day to go. We don't have time to set those intentions. And so that allowed me to recommit to that process. And we just really need it as healers, as people who take care of other folks. We need to make sure we're fortified first before we reach out to other people. So,
Yeah. I think that's a really good lesson. I think oftentimes we forget that in the hustle and bustle post-pandemic, that people have in the pandemic, in some ways, the way we got through was this aggressive, I call it, relentless self-care that was necessary to be able to get through each of those days. And then in the face of the harder it gets, the more diligent you have to be with your power hour and spending the time to fill your cup so that you're strong enough just to stand up, really.
just to stand up, it took
Yes.
so much time. Also, what I'm gaining from a lot of that too is the clarity, right? So, I had two sisters. One passed away 14 years ago. The one passed away most recently in May. And so now I'm the last of the sisters. And I'm thinking, what's important in my life? How do I want to spend my days? Who do I want to be around? How do I want to feel? And that is part of the reason why I started my own coaching business. I was at a lot of different companies where there was no one that looked like me to mentor and offer professional development, personal development, coaching. And I just kept hearing this little voice that said, listen, go back into entrepreneurship. You can do it. And so when I got the opportunity, I said, I'm definitely going to make the pivot. And I love that I'm talking to people and putting that spirituality and that consciousness in with coaching
Mhm.
because we know when we're misaligned, right?
Right. Right.
You really do know when you're misaligned. And sometimes we have to take the jobs for the money. But then there are other opportunities where we say, um, I think it's time for me to expand into a different area. So through my coaching services, I really sit down with people and get them to look at what it is that they desire out of their life. We make all these vision boards, right? So let's execute on the vision board. Let's look at your past accomplishments, your successes, and decide what your path going forward is going to be. And I must say, I've had some clients that are like, oh my gosh, this was so wonderful. I didn't know I could do all this. I had all of that in me. Yes, you do.
I know. It's funny how it takes that big pause and reset, and you don't really think you need it until you actually go through that process. I even remember with my own coach, it took me months, weeks to figure out where I had been because I had never stopped to think about it for 40, what, 8, 46 years. I hadn't thought about it in a long time. And so until you ever take stock and reflect back when you're writing personal statements every couple of years to get into
Oh
residency
my
and
gosh.
fellowship, you actually have a chance to think about yourself. But then 20 years goes by and you actually aren't thinking about yourself. And that's why those really career pivot points, really spending the time with intentionality, probably every 5 years, making sure, am I in the right direction? Have I done this body of work that I'm going to do? And then is it time to go find the next leap, the new exciting thing, the new 10 degrees? And I think that was the harder thing too, at least for me. You often get advice where you're supposed to like pivot, do a big pivot. Big pivots are scary. It can just start with a 10%. You can just do a smaller change.
You can get a coach and just talk it out and the light bulb goes on. Wow, I could. But you have to become accepting of that. You could, yeah. I had a client once and I were outlining, we're doing a discovery call, something like that about her background, everything that she'd done. And she called me on the phone and said, no, this can't be me. I said, you accomplished quite a lot. She was, I would be afraid to tell anyone this. I said, it's you. It's you.
I'm curious, what are common pitfalls or myths that physicians or healthcare leaders believe about their life and career? Because when your clients in healthcare finally get to you, they always I think they're always pleasantly surprised about how awesome coaching is. But then they have to probably self acknowledge like little things they probably told themselves or didn't really realize was falsehoods. I'm curious, what kinds of common themes do you see in the healthcare industry for leaders that come to you for coaching?
That's all that they can do because they've been studying and doing everything pertaining to medicine for so long that they're thinking that's all that they can do. And even when I pivoted into digital health, folks were like, what are you doing here as a doctor? And so realizing what your value is, that's a big deal. And then they think, I won't be able to make any money if I leave here. And that's just not true. And then sometimes they think that because of their title, their status, that maybe they're supposed to be miserable. I'm like, no, you're supposed to have a good life. As far as miserable is concerned,
Yeah.
not having any free time, not being able to see your family, not being able to sit down for dinner. They just think that comes with the territory. And that it's just not true. Yeah, it's just not true.
Wow. It's incredible. Those are some very deeply internalized stories that we have told ourselves. Yeah.
Yes. And they've seen examples of it.
Mhm.
So they're like, okay, I'm here and this is what I have to do. Meanwhile, the whole world is crumbling around them. They don't have a relationship with their kids,
Right.
their husbands or wife was not speaking to them. They're like shadows in the night. They don't have any home life responsibility. They don't feel plugged in. And so you have to pay attention to what your personal life look like as well as your professional life. And then how can you marry the two?
Right. Yeah, I think it's the hardest question I always get asked, like, whenever I'm asked, "What do you coach about or what do you coach on?" I'm like, "It's everything, because 'cause they're all intertwined. Everything about you, your health, your life, your person, your relationships, your career, it's all in one, really, in general."
It's hard for people to take a look though. That is
Mhm.
the most painful thing. Yes.
Yeah, that is true. And so why are you so passionate about improving, healthcare now as a consultant, an inspirational speaker, and executive coach? Like you said, you now have a chance to really be intentional and visionary in this, next body of work that you're going to accomplish. I'm curious what gets you up in the morning and what are you so passionate about right now?
It all comes back to the doctor-patient relationship, right? The clinician and patient relationship. And there's a lot to be inspired about as far as that's concerned. We all went into medicine because we wanted to have those relationships. We all went into medicine because we wanted to talk to people. We learned so much and we wanted to convey that to them. And we wanted to consider each person as an individual. Like, I want to know you and your family and how it is that I can help you. But that's eroded a lot in healthcare. And when I think about the quadruple aim, it used to be a triple aim. Now it's quadruple aim where you add in clinician satisfaction. That is huge. So that could be mindset. That could be what's your perspective of joy. That could be your outlook on abundance. And when clinicians are well fed spiritually with good nutrition and they feel supported, they can do so much more for the healthcare system and their patients. And that has to be recognized. We have to be part of the plan.
Yeah, I love
So,
that. I think in that respect, both of our companies are very aligned on that mission. At the end of the day, we all want to help healthcare clinicians thrive and in their life and work, and so that they can be better versions for the downstream effects. We all make ripple effects we don't even really realize with when we show up really great in our teams, we have innovative ideas for organizations, and most importantly, with just the one-on-one daily care. We know that by reducing burnout, we actually make less errors, and so having a really sustainable workforce, is really important, and it's only going to get worse if we don't do something about it, which is why it's so exciting that you're also doing this work, in the field, as well. So I'd like to offer you the opportunity for any other last words of wisdom and guidance that you'd like to impart for everyone in healthcare.
I would say pour into your lamp, right? We're all lamps and lamps need oil. So we have to take the time to provide sustenance for ourselves first, pour a little oil in us first so that our flame, our light can continue to shine and so that we can touch so many other lives. But I will also say stay curious.
Mhm.
The outlook of a child, think about other things that you can impact as well.
I love that.
So that's to me, that's the big deal. Stay curious and nourish yourself.
I love that. Thank you so much, Dr. Camille, for coming on with us. And how can people find out more about you, stay connected, work with you?
Sure. So my website is inspire to the number two evolve, evolve.com. But I'm on LinkedIn under Dr. Camille White, or I'm also on TikTok. I have a lot of fun on TikTok, as hopefully the government won't ban it, well as Facebook and Instagram. So I'm available. And then a nurse practitioner, reached out to me from Reddit. I hadn't been on Reddit in a few years, and she reached out. So absolutely open to having conversations with folks and sharing my insight.
Awesome. Thank you so much, Dr. Camille. Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share it with your friends and colleagues in healthcare. And we will love it if you hit subscribe so that you never miss an episode. We want to help with the topics and problems that you want us to talk about. Leave us a review wherever you listen to us with suggestions, feedback, and praise. It means so much to us, and we actually read every comment. For deeper support in your life and work as a healthcare professional and leader, head over to transforminghealthcarecoaching.com. Download our free 5 reflection questions to jumpstart your journey and join our email list to be the first to know about our coaching programs. We're also excited to offer the MedThrive community, a supportive space for group coaching and self-paced personal growth, providing an alternative path to growth beyond one-on-one coaching programs. Find out more and join this thriving community at transforminghealthcarecoaching.com. Together, we can transform healthcare, one person at a time.